I have been part of healthcare teams for a very long time. I won't name decades, but it is in that range of decades. It's the most energizing part of my professional life, is working on teams. And I include the families and the children as key parts of those teams. To be a little more specific, I've worked in, I'll tell you about 3 kinds of teams. I'll start with the most unusual, but one that I have vivid memories, and that was going in 2005 to Louisiana as part of a healthcare team for disaster work. And that was incredibly stressful, very rich, bonding, non-hierarchical experience of arriving with 60 people in an area that had been ravaged by 2 different hurricanes, and trying to make our meager skills and resources make a difference in the time of a disaster. And that was something that made me very humble. And it's because all of our high-tech knowledge, skills, and machinery are often not what makes the difference. It's mental health, it's nutrition, it's shelter, it's relationships. I'm currently, and have been for, I will say, 30-some years, part of a team every Friday afternoon when I'm not traveling. And we work with the families of children who have had ill or premature infants who have required neonatal intensive care. So I work on a team that does an assessment following their discharge from the hospital. So they periodically come to our center, a neuropsychologist, occupational therapist, myself as a nurse practitioner, and neonatologist are all key members. We bring in speech therapy, nutrition, we have consults through pediatric ophthalmology and so forth. So I have the privilege of seeing what this outcome was all about. What is the life course for this infant, but more importantly for this infant within the family as they grow up? And I recently did a study finding families whose formerly premature babies, well, they were premature babies, were now entering college years, and interviewed about 7 of those families. Marvelous, marvelous conversations. And what makes the difference is relationships and information. So it's not enough to be the nice provider. You have to have the nice, informed, respectful provider-patient-family relationship. And doing that as part of a team, which I'm privileged to do about once a week, with sometimes I see 1 family all afternoon, sometimes I see maybe 5 families. We problem solve for these folks with these families, and it's extremely rewarding. They come back to us, and we have evidence that we do make a difference in coordinating their care, making the referrals, but even more importantly, taking the expertise we have from working with hundreds and thousands of these families to then call their rural community and say, did you know that with this sort of situation, this health concern or risk factor, this will make a difference. So we're taking the expertise, empowering the family and the community to get the best possible health outcomes. And premature and ill neonate outcomes are actually very good. It's been exciting through the decades to see these children who were born maybe 2 months early 20 years ago as the miracle children. And it's not a very nice term, but it is the community verbiage for it. To now we're seeing children born at 23, 24 weeks come walking in, doing well in school, having rich, full lives. And so it's using the technology with that community support and the care coordination, providing the evidence where it needs to be applied. It's very rewarding work. So team, yes. The other place I've worked on a team is in the emergency department. I did this for about 10 years on weekends and evenings. You can edit this out, but it was how I paid for my kids' college, partly. So working in an emergency department, building relationships very quickly with families you may never see again, but making a key difference at that teachable moment. We talk about teachable moments with families, with patients, and when you're in the emergency room, that is a teachable moment. But the important thing is it's not all one-way communication. And we now have a term called teach back. And so the families have to tell us what they heard. And at a time of stress, there are studies showing people only retain 10% of what we tell them. So that is a very key piece of our way of working effectively. And it's called teach back with families. And teams can learn to do that very well.
That's